Good afternoon, everybody. It's good to be back. Let me just change my view here. Perfect. And I wanted to start today by introducing some new people in new roles, one of whom you've already heard from. So I'll start with Jody. As you know, Jody and I have worked together for 3 years over at the Human Services Department. Jody's been heavily involved in coverage and help with communications in the pandemic from the HSD side and the governor's office, now with the OH. And she's decided that the next career challenge ahead of her is coming to the Department of Health and not just helping us move to a new level of communication regarding the pandemic, but to begin to look into and start communicating a lot more with all of you about all of the other amazing programs and services that our department provides for the people of New Mexico. So you'll be hearing more from Jody. I told Jody that the main disadvantage of coming to work at the Department of Health would be that she'd still have to work with me, but she said that wouldn't bother her at all. So Jody's here today and heading this up. Next is Andrea Lawrence, moving from right to left. Andrea is also a state employee. She is at the tourism department where she's done marketing there for quite some time. She is coming over as an official new position in the Department of Health as the director of marketing. We haven't had one of those before. When I started here last year, I thought that was a really critical addition that we needed to make. Andrea brings a wealth of experience, and also her boss, or her boss's boss, Jen Schreier, is really just done an amazing job helping our department with the marketing around vaccines, testing, a lot of our messaging as well for this pandemic. And so we're looking forward to Andrea stepping in, taking those responsibilities on, and then also starting to tell you all more about great programs and services we provide. And then lastly, another person you'll be seeing more of, Jose Acosta. Jose applied for the job of Chief Medical Officer at the Department of Health, and turns out in the interview process discovered that he's one of my neighbors. He lives about 1.5 miles away in Placitas. Interestingly, all 3 of these folks started on Monday, so we have 3 new positions. Dr. Acosta has a wonderful background and experience in being a chief medical officer. He was last at the very large Loma Linda Veterans Administration Hospital in California, has been had positions of very high responsibility in the U.S. Navy, from which he recently completed his career. And so we're delighted to have him on board as well. And over the holidays, I was trying to reflect on what's the next thing I could do to make our state more effective in the pandemic. And I realized it was really hiring great people into all these empty positions. So we're just about full up now and a few more decisions to make, but these folks will be contacts, and I'm sure you'll be seeing more of them and hearing more of them as time goes on. So thanks for indulging me in introducing some of our newest folks. Let's go into the summary of the pandemic. And I got to talk to a number of reporters last week about, hey, 2 weeks ago, Dr. Grace, you told us we weren't ready for the end of the mask mandate. And then 1 week and 1 day later, all of a sudden we are. What happened? And I think these graphs actually tell the story better than anything else. The red boxes indicate what's happened over the past 2 week period of time. So you can see 2 weeks ago, we had 13,432 cases over the previous week. And this past week, we've had not quite a third of that, but a little more than a third of that. Sorry, but not much more than a third of that. Hospitalizations have dropped by more than half as well in that period of time. And death rates are about the same, despite what you see in the graph. There's a lag that we've talked about many times. And again, we're now we're at 6,794 New Mexicans who have died from coronavirus. Every one of those people is important and lived a unique and important life, and they leave behind families and others who are grieving. And each time we talk about mortality, we like to pause for just a moment and remember those folks who did succumb to the disease. And we are going to talk more about additional vulnerable people in New Mexico that I and my staff at DOH are worried about as we go on. So you can see, particularly in cases and hospitalizations, a very significant improvement. Next slide. Another question reporters asked me last week is, if we're not going to be focusing as much on cases anymore, and we're focusing on more serious disease, what are the metrics around that we'll be looking at? And here's one that we've been tracking since November of 2020, and that's every week, the hospitals, when things aren't looking good, get together and rank their ability to respond to the current volume in the pandemic. And if you're interested and you go to the MAT website, you can see the scoring matrix that they use every week, but it includes things like staffing and equipment and all the things hospitals need to run when they're over 100% capacity. And so you can see we spent a very brief amount of time, it was only about a month in November, December last year in crisis standards of care. It was declared for only a month and then it expired. We declared crisis standards of care about here in early October, I believe it was, and that has been going for quite some time. When we rescinded the mask mandate for everybody but healthcare workers, we did it. We knew that we still had crisis standards of care in effect. Our plan currently is just to let that expire. Some of our crisis standards of care designation has helped us get federal resources, and we want to continue to maintain those. But I think most hospitals are now really feeling like they're out of the woods. We still have hospitals at 100% capacity. We still plan to try to support those hospitals as we are able with additional staffing resources, but workforce still is our key issue here in New Mexico and something we're still working with our hospital partners and others to try to resolve. Next slide. As further evidence, for those of you who've been watching these press briefings for a year or two, you know we've been showing these maps of how many ICU and general medical surgical beds we have. If you've been watching regularly over the past 6 months, you know that total number of beds for ICU beds in red there on the right, on the left side of the slide, Brianna, maybe you can highlight that, is 34. Typically, over the past 4 months, it's been a single digit or in the teens. So we're really opening up some ICU beds, which is a relief. That number represents about 10% of our ICU beds, which is what I think a healthy system in normal times should have open. And so we can see that both on the ICU side and on the general bed side, we're double the highest we've had in quite some time, that we're doing really well and having room for COVID patients. Well, what does this mean for you and me? It means if one of us has a heart attack, there will be an ICU bed for us, at least somewhere in New Mexico. And if you remember from previous weeks, there were very few ICU beds in the south part of the state, and those are starting to open up a little bit more this week as well. So great news on the hospital front. Hospitals still struggling with being able to obtain enough staff and also struggling with being over capacity still, but we're out of the worst of it. And I think I wanted to thank our modeling team for giving us this couple weeks of advance notice and once again being right on where cases and hospitalizations were headed. Next slide, please. Going to shift over now to just a brief comment about the taking away the mask mandate except for healthcare facilities. And that was actually at the strong request of healthcare facilities that we continue to have that. So what that means is we now have a choice, the responsibility of deciding how to keep ourselves safe, our families safe, and our community safe has moved from state government to the individual. Some people are certainly very glad to have that responsibility, and other people are puzzled on how to work through that. But just to make sure we're all clear, masks are just as effective today as they were 2 weeks ago. They still provide substantial protection. An N95 mask can give you an 85% reduction in your chances of getting COVID, all other things being equal. And so we still have the case in New Mexico that a business or a school board or a community organization can still make their own rules for their own organization, and some may require masks to come in. And I just would ask everyone in New Mexico to respect that. We also want to talk a little bit about immunocompromised individuals today. It's a big, big concern on my part, on my staff at the Department of Health. What will the impact be on immunocompromised people and other vulnerable people when we no longer have a mask mandate? Well, of course, if a vulnerable person goes out into an indoor setting in a room full of people without wearing masks, even if they're wearing one, then of course their chances are going to be higher than they would have been going into a room where everyone was wearing a mask. So that's just obvious, I think. But I'm going to show you another couple slides because we're doing an outreach today to immunocompromised people to try to get them the resources they need. In particular, and we've said this before, but now more importantly than ever, if you are a person at high risk, upgrade your mask, wear a KN95 or an N95. Again, make sure it fits snugly against your face. It should move in and out when you breathe. And that's how you know it's a tight fit. And I would recommend at this point in time, picking up a surgical mask, or better still, a KN95, or better still, an N95, particularly if you're immunosuppressed. Not everybody can wear an N95 mask all day. We understand that. So you want the mask you can wear that fits the tightest, but that you can keep on all day if you are at high risk. Next slide. Now, specifically with respect to immunocompromised individuals, we sent out a press release this morning. We've texted all of the people who registered in the vaccine database as being immunocompromised this morning. And also yesterday, we sent a message out to all our providers warning them that we were going to do this. But there's a lot of different categories for immunosuppression. But in particular, if you're getting chemotherapy, you had an organ transplant or bone marrow transplant, if you have an inborn immune problem, and this is a short list here, there's lots of them. If you have an advanced or untreated infection that could affect your immune system, if you're taking prednisone, and a lot of New Mexicans take prednisone, or if you're on certain other, interestingly, monoclonal antibody drugs for things like rheumatoid arthritis and some cancer treatments as well, all rheumatologic diseases, you probably are at higher risk and you may well be immunosuppressed. The best way to confirm that is to talk, of course, with your treating provider about that and get them to weigh in. But if you fall into any of these categories, we're asking you all to take extra protection. And that's why all the folks here are wearing a mask in our little info graphic. Next slide, please, Brianna. Evishield, we talked about briefly. We haven't featured it at a press conference. It's a longer acting monoclonal antibody that in scientific studies bolsters the immunity of the immunosuppressed. I think we've talked about the fact before that if you are immunosuppressed, you're not likely to mount the same kind of antibody response to 2 doses of the vaccine. And I'll talk about the vaccine in a second as well. But it's an effective treatment that will dramatically lower the risk of getting COVID. And the blue on the graph on the right, the blue bars are how much of Evishield we have in stock, and the red bars are how much we're giving. And we'd like to see that red bar go up in the coming weeks to try to cover all the immunosuppressed people in New Mexico so they get that extra coverage, particularly after the mask mandate has been taken back for all but healthcare facilities. The other thing that's been a recent change is initially you had to be an oncologist or a transplant surgeon or a rheumatologist to prescribe this. But of course, there are lots of people who are in rural areas we don't have those specialties. And so now any prescribing provider in New Mexico can prescribe the drug. And we're also in the middle of the outreach to all providers to encourage them to sign up to prescribe this medication for more vulnerable people who are immunosuppressed. There's something else. So we've got masks and we've got Evishield. On the next slide, just a reminder that the CDC is now up to recommending 4 doses for immunocompromised individuals. So you might remember this in August when they came out and said, we're not recommending a booster, we're recommending a 3rd dose, which was the same vaccine as the booster, but they called it a 3rd dose. And so we had a lot of immunosuppressed people sign up and take that 3rd dose of the vaccine. And then more recently, they came out and said, okay, the clock's ticking. It's been 4 months since immunosuppressed people got their 3rd dose. Now you can get a booster. They even recommend it after 3 months, again, to try to keep stimulating the immune system of immunosuppressed people with repeat challenges to get them to build up their immunity. So again, DOH has no restrictions on this. You can go online to register for the vaccine. You can talk to your, your providers about whether they're providing it in the office. And if they aren't, you should encourage them to do so like we are. And I think we're gonna actually, between these 3 things of better masking and more, and making sure immunocompromised folks are up to speed on vaccines and use of Evishield, I think we can dramatically lower the risk to our most vulnerable people here in New Mexico. And speaking of our most vulnerable people in New Mexico, I sort of feel like, can we go to the next slide, Brianna? I feel like my wife and I, between the 2 of us, have this covered. As you know, she's an oncology nurse and runs an oncology program in Albuquerque, and I'm a geriatrician. The other really, really high risk group, and this came out in the news about 10 days ago, is the risk of hospitalization, but particularly mortality in older individuals. So this graph has 3 colors. The red is the risk in unvaccinated people. The light blue or medium blue is, or royal blue is that? I don't know, fully vaccinated without a booster. And then the dark blue, which you can barely see on the top 2, but you can see in the bottom one, is fully vaccinated with a booster dose. And so, once, if you're over 65, you're 3 times more likely to die if you get COVID. I mean, that includes me. And so I continue to be careful and I continue to choose to wear a mask. I used to be that I was telling myself I had to wear a mask, but now I get to choose whether or not I wear a mask. But over 75, chances of dying if you get COVID, 140 times higher if you're unvaccinated. Over age 85, it's 340 times more likely. So striking statistics. Would encourage all older individuals, particularly if you have risk factors, to continue to protect yourself and, don't throw off your mask and go to a rock concert and slosh around in the mosh pit anytime soon. Despite the decreasing case counts, we're like, about as high as we were prior to August. And so we want to make sure that everyone's being careful, taking care of themselves. So particularly immunosuppressed and older people, please exercise caution. Next slide. And I'm going to speed up to get to the end. We've been taking you through one by one various vaccination reports. Brianna, are you going to bring that up or do you want me to share my screen? I can do it either way.
I can do it, David.
All right, go ahead. And this is a good one. We have slides from this in almost every presentation. I'm not going to spend time on every page. And we're going to start on page 3, which is over the last 4 weeks. What are we seeing in terms of cases, hospitalizations, and deaths, which run from left to right, in not fully vaccinated people in the orange, fully vaccinated without a booster in the blue, and fully vaccinated with the booster in the green. So one thing this shows us, like at first you might think vaccines don't work, but actually the rates, we'll show you in a minute, are way, way higher for all 3 of these things if you're unvaccinated than vaccinated, and higher if you're simply vaccinated without a booster than if you have the booster. And so, but now we're down to your risk of testing positive is only about 1.3 times higher than if you're vaccinated without a booster. And you can see it's 2 times higher if you have a booster. And then the risk of hospitalization and death, 2 to 3 times higher without vaccine than with. And then down below, if you like math, which I do, all the numbers are there of the different rates. And you can see the colossal difference rate, 1.587% of people who weren't fully vaccinated have, sorry, I'm doing this wrong. It is, 2.85% of people who are not fully vaccinated got COVID in a month period of time, 2.2 with the full vaccination, 1.5 without. So let's go to 1 or 2 other pages. Go to page 4. This is just the rolling average case rate per 100,000 population. It's another version of this, but I want you to pay attention to 2 things. Notice the distance between the orange line for unvaccinated and the blue line for people who've had the full vaccine. It's not very far apart. On the other end, the drop from blue to green, which is vaccine with booster, is pretty big. If you go to the next slide, though, this is hospitalization rate, and you can see a much bigger gap. And so what that means is that while people who've been vaccinated are still getting cases, their chances of being hospitalized are much lower with the vaccine and much, much lower with the booster. Maybe the next, let's go to page 11 and then we'll get back and finish up here. Lots of valuable information in here. We encourage you, we had a lot of questions, and this is just, there is a slight difference. It looks like Moderna is now clearly has a bit of a demonstrable difference in breakthrough case rates than Pfizer and Johnson & Johnson. Of course, the Moderna vaccine is about twice as strong initially, so it has more side effects than Pfizer. All my shots so far have been Pfizer, but it's just helpful. We have a great Department of Health and a wonderful epidemiology team that can produce so much data. So let's go back and do the last slide or 2 and we'll be done. Last slide. So the cartoon is by Ricardo Cate. He's from Santo Domingo, Pueblo, a very popular Native American cartoonist that I've worked with at HSD in the past. And he's saying, when I'm out and about, I still wear my face mask. So when I get home, I can do this. And he's there saying, hi, Mom. And she's saying, hello, son. And they don't have their masks on. So appreciate that sentiment. She's one of those high-risk people. As a geriatrician, I can tell you, she's 79 years old, I think, in that picture. And so her family is being extra careful for her. So bottom line, hospitals finally seeing some relief, and our intent is to let the crisis standards of care designation just expire when it comes due in March. Second, it is still a requirement to wear a mask in hospital and other congregate settings. So please just respect that. Please respect the people working in those settings. Don't give them extra work by walking in without a mask. Just know that that's part of it. Nobody wants to bring in COVID in a visitation situation. And this is what we're doing to make sure that that doesn't happen. Also, everybody gets to make their own choice now. And I'm hoping that we don't immediately draw conclusions or develop harsh opinions because because somebody's doing something that we don't do. I'm still wearing my mask in all the settings I wore my mask before. For the most part, it's a choice I make. I'm older. I've got some risk factors. I also know that I work with, immunosuppressed people. So does my wife. And so I'm extra careful. The resources online to find testing and actually free testing in your community still out there. We'll let you know when we're ready for a 4th vaccine dose for non-immunosuppressed people. We're waiting for that data to come in. And then just lastly, I think that taking the mask mandate away is really going to open up a whole new set of discussions for people in New Mexico, and that we haven't had to have. And I know from my emails that there are people out there with extremely strong, unflexible opinions on both sides of this. And part of me worries that what New Mexico needs right now is for people to freely be able to talk to each other without judgment, without accusation, without recrimination for choices they make or positions they might advocate at a school board meeting or at the workplace, in a workplace meeting. And so I'm kind of hoping that we can use that wonderful New Mexico inclusiveness that was part of the reason I moved here, actually, once again, and that we can all make some sort of commitment to, in these discussions, start with being more curious and less accusatory. I mean, start by seeking to fully understand a different point of view before making sure others hear your own point of view. You know, having compassion, this is a tough time for the state. We're going through a whole new phase of this. People will have different opinions, and but what we have to accomplish as a state really goes beyond our own individual needs to the needs of others, the needs of a community. And, you know, and lastly, I think being empathic. I mean, we don't know if that person wearing a mask has an immune disorder or a multiple risk factors. And I think being understanding, not being apathetic, but being empathetic, I think will get us through. But I think it's going to be kind of a challenging period of time as we make rules in our homes and restaurants and businesses and school boards and in schools and the like across the state. And just remember, as Miss Manners once wisely said, it doesn't cost anything to be nice to people. And so, Jody, I'm done, and I'd like to extend the Q&A time because I talked longer than usual. Let's say we'll go to 1, okay? Jody, you're on mute.
Thank you. I was talking and didn't know. We'll go in the order of the hands that I see raised. We'll start with Lou DeVisio, and next we'll go to Jared Ebenreck. Lou, you are unmuted.
Hi, thank you. Can you hear me?
Yes.
And could you let us know your outlet? I wasn't sure.
I'm a producer at New Mexico PBS. Thanks for taking my question. First of all, I know you said at the beginning that the data shows that this was a prudent move at this point to end the mask mandate. But to be clear, were you consulted by the governor before she made this decision in any way?
I was really consulted by the governor before she made this decision in every way. You know, we've had an ongoing conversation about this since the beginning of the pandemic. I was over at the mansion a couple weeks ago this morning at 7:30, talking with her about various options going forward and what we would need to see. So yeah, I mean, I talk to her all the time about the pandemic. She's still very involved, very interested. And so not exactly sure I understand the genesis of that question, but yeah, she loves the data. She loves to hear what's going on. We text her an update every day about what's happening with the pandemic. So she was in the loop and completely, and I was too. Thanks.
Okay, next we'll go to Jared, and after that, we'll go to Selena Madrid. Jared, you should be unmuted.
All right, can you hear me?
We can hear you.
All right, wonderful. My name's Jared Ebenreck. I'm with KUNM, and by many estimations, some of the immune suppressed people that you've heard or are discussing, sorry there, I'm just getting distracted by my environment. Let me put this aside. By many estimations, most New Mexicans would know somebody that is at increased risk of complications if exposed to COVID-19, not to mention that nobody wants long COVID. Only 6 weeks ago, everybody was supposed to get N95 masks that they now apparently do not need in most settings. What do you say to vulnerable New Mexicans and those that love and care for them that feel thrown under the bus by lifting the mask mandate early to return to normal and learn to live with COVID, even as data about a new variant and previous variants are still being sifted, with the existing mandate that would have expired March 4th, extended just 3 weeks ago? That would have allowed school districts, caretakers, healthcare facilities more time to plan, and hospitals more time to catch up. What do you say to these vulnerable New Mexicans and overworked healthcare workers?
Well, first, I gotta just say that I don't agree with the premise of your question. It was, if we were in court, my attorney would stand up and say, leading question, Your Honor. So just want to call that out. The question defines the decision as being premature. I don't agree with that. I think the Department of Health attempts to do what we do for the benefit of the most people at any given point of time. So not only do we all know someone who is at higher risk, I mean, a lot of us live with those people. I mean, every person over 65 is at a higher risk. Everybody with high blood pressure, everyone who's obese. And so this is universal. And this is not about requiring all New Mexicans to wear a mask until we don't have any more vulnerable people. It's about trying to time the decision the best we can. I've already gone over what I say to immunocompromised people, but I can say it again. Wear your mask. Wear an N95 mask when you go out. 2, make sure you're up to date on your vaccines, which for you may mean a 4th vaccine, preferably an mRNA this time. Get Evishield, talk with your provider, see if you're a candidate for Evishield, which will also protect people. The pandemic we're in right now, Jared, is a very, very different pandemic than we were 2 years ago. And so we have a lot more tools now than we had then. And I think comparisons of why we're doing this today when we didn't do it before, I'm not sure that those take into consideration all the variables that are really out there. But to finish up, what I say to immunosuppressed and other high-risk individuals is we care about you. We contacted your providers yesterday. We sent you a text today pointing you to a website that will show you what the resources you have available. And again, this is not a decision. And again, I kind of resent the throwing people under the bus. And I'd ask you, you might have been distracted, but you might not have heard what I said about being more charitable and seeking to understand and not being accusatory. And I think that advice, should apply to both of us as well in the press conference. So thank you.
All right, next we're going to go with Selena Madrid, and after Selena, we'll go to Julia Goldberg. Selena, you're unmuted.
Hi there. This is Selena Madrid with KFOX 14 and CBS 4 out of Las Cruces, New Mexico. You might have already said this, but can immunocompromised get both Evishield and a second booster? And then how will the DOH make sure people who aren't immunocompromised aren't saying they are so they can get the extra dose of the vaccine?
So yes, we recommend that immunocompromised people get both. Get that 4th shot. And that's exactly what the CDC recommends. And we think that scientific data showing the efficacy of the 4th shot and particularly Evishield are strong enough that we recommend both. So the answer to that is both. And then in terms, we are not policing who gets vaccines. There was some of that going on with our gradual rollout of the vaccine when supply was very limited, but now supply is abundant. And we kind of actually have confidence in the people of New Mexico to do the right thing and don't feel like we need to have a role to make sure people don't get an extra vaccine here or there. The other thing is, and we learned this the hard way early on, that there's a lot of unique circumstances. They're rare, but for example, if you have a bone marrow transplant, you're starting over and you haven't, as far as your immune system knows, you've had no vaccines. And so in theory, there could be somebody who got a bone marrow transplant today and would already has had 4 vaccines and would be eligible for 4 more. And so we're not taking it upon ourselves to try to regulate that or control that. And the other reason why is because we don't want there to be any barriers. We wanted to make it as easy as we can for providers to have the vaccine supply in their office, to be able to give it to people and to give them that booster when it comes due for everybody, or is due now for people right while they're in the office. So we don't have a system in place for that.
All right, next we'll go to Julia Goldberg from the Santa Fe Reporter, and after Julia is Austin Fisher. Julia, you're unmuted. You can ask your question.
Thank you, Jody. Thank you, Dr. Grace. Last summer, when the health department started offering the 3rd booster to folks who are immunocompromised, DOH told me they had a little over 30,000 folks who'd marked immunocompromised on their vaccine registry profiles, and that jumped to around 57,000 when you added the cancer registrants. I'm wondering if that's a decent ballpark number. And I'm also wondering, you mentioned that Evusheld is in ample supply for them. Nationally, I just read it was in short supply, and some states are actually having lotteries through doctors' offices. So I wondered if why it was ample here. And then I'm sorry, Jody, I know this sounds like 3 questions, but I just want to clarify, it's prophylactic. Yes, it's the only prophylactic measure. Okay. All right. Those are my 3, but only 1 actual question.
What was the first question again? Oh, the ballpark numbers, that's what I'm using. You know, for example, this morning when we sent the text out to immunocompromised people, we did not send it to people who had cancer, because many folks who filled out the vaccine form initially, if they'd had cancer 20 years ago, put that down as something that they'd had. It may be a slight risk factor, but not to the degree of someone who has cancer and is undergoing active treatment, who should have at least, and hopefully will in the future, checked off both cancer and immunosuppression. So I think those are reasonable numbers. I think the comments today are really mainly toward immunosuppressed people. And we debated that with that yesterday because we were worried that, you know, I had a skin cancer somewhere, I can't forget which side, on my face, you know, 8 years ago, but I'm fine. I didn't check that box. We didn't want to confuse people. A lot of people who might not be eligible. So
right around 30,000, you think?
Yeah, I think 30 is about right. You know, like I think of it as like 1.5% of the population. And then on the Evusheld, I think part of the non-shortage in New Mexico is needing to get more people to get it. So if we had a shortage at this point, if we started facing a shortage, I would think that would be a wonderful problem to have. And then the governor and her staff in Washington would start advocating for a better supply for New Mexico. So I think right now we just have to ramp up, but every person, because it's prophylactic, because it can prevent you from actually getting a serious infection, I hope that every immunosuppressed person in New Mexico will pursue this. And then we'll work on I don't see a lottery in our future, but I could see something a little, like if we had to have a waiting list, we could certainly do that. And we've got a great pharmacy staff at the Department of Health who I know could help us manage that effectively.
All right, next we're going to go to Austin Fisher, and after Austin, it'll be Matt Hollinshead. Austin, you are, I'm trying to unmute you, just a moment.
He just got muted.
Can you hear me?
Now
Yes,
we can. Yeah.
we can hear you. Could you let us know your media outlet?
Yes, I'm with Source New Mexico. And thank you so much for taking our questions, Dr. Grace. So my question is really basic. What is the scientific rationale for removing mask mandates?
I think the reason that we implemented a mask mandate in the first place was try to protect and preserve our hospital resources, which was the critical research shortage. And when we saw that basically drop off of a cliff, in cases and hospitalizations, and hospitals confirmed that with their own self-evaluation, we decided that it was time to remove the mandate. It isn't, I don't know that I agree that you need scientific evidence to remove a mandate. I mean, I think the role of government is to step in when necessary in critical situations, and also to step back when you're out of that difficult period. So as I said earlier, masks are just as effective now as they were 2 weeks ago. Most people should really consider, based on the people in their family and contacts and the like, how careful they need to be. And I'm not really changing my mask routine at all yet. Thank you.
Okay, next we're going to go to Matt Hollinshead.
Hi, Dr. Grace, can you hear me?
Yes.
Okay, I appreciate you taking the time, sir. I'm with the Rio Rancho Observer. Seeing how much cases have decreased in recent weeks, seeing the steep rise be met with that equally steep fall, I guess, and pairing that with, I guess, the vaccination numbers, I guess, do you see anything with all that data to maybe suggest that those lower numbers will just stay down like that? Like, and maybe potentially we could get closer to that endemic stage, or do you think it's too early to determine whether they'll stay lower or not?
Yeah, well, unfortunately, the virus itself has not yet surrendered. And so I'm assuming that we will see another wave. So far, for the big waves we've had Alpha, Delta, and Omicron, there's been exactly 6 months between the rise of those. And so if that plays out again, which there's no guarantee, I would expect to see an uptick in cases due to a new variant in the June or July timeframe. And as I said earlier, if we do have that big uptick in cases, and we have 5,000 cases a day, but we have an efficient system for getting oral treatments to people that will lower their risk of hospitalization and death by 90%, then it's a completely different ballgame, right? 5,000 cases, lots of testing going on, lots of people staying home from work, but only 80 people in the hospital instead of 700. So I think we should assume that the virus will continue to evolve. I think we should assume there'll be other waves coming through, and then we can hope and pray and wish that those will be a little less severe. Omicron was less severe than Delta was, certainly, in terms of hospitalizations and deaths, although the surge we saw was because there were so many more cases of Omicron. So yeah, I don't think we're looking at the very end of this, but I do think we're all going to get a break here, or at least I'm certainly hoping we do. I've encouraged every single person I work with in both departments to take a vacation, in the next couple months and get away and get restored and refreshed. But I'm kind of hoping that the next time the virus comes to town, that we'll have additional tools, maybe another version of the vaccine that's more global and not variant specific. Those oral agents like Paxlovid that we'll have handy and abundant supply. We're supposed to have 10 million more doses nationally by May or so, that we'll have those ready. And so that while we might have a lot of cases, we won't have the same kind of burden of severe disease that we've had so far. Thanks. Good question.
All right, next we're going to go to Brittany Bade at KRQE, and after Brittany, we'll go to Ryan Botel at the Albuquerque Journal. Brittany, you should be unmuted.
Hello, can you all hear me?
We can hear you.
Yes.
Okay, wonderful. Thank you so much for taking the time today. So my questions are actually surrounding teen pregnancy, so a bit of a different wheelhouse of the Department of Health, but tied to the pandemic. So, and I had submitted these, but what do you think of the latest numbers on the current teen birth rate in New Mexico? And do you think the pandemic has impacted the number of teen births or pregnancies, given it looks, similar-ish to past years. And then I had also seen on Instagram that the DOH is seeking requests for more programs, more education to prevent teen pregnancy. Is there any hope for that? Any kind of vision you would like to, or education you would like to, to spread to the teens of New Mexico? And those are my questions. Thank you.
Yeah, thanks so much on that. I think it's a really good question. It's kind of fun to answer a question that actually covers the Human Services Department, the Medicaid program, the Department of Health. Sort of, I feel like I'm in my element with this, so thanks for asking. I think we don't have the numbers for last year yet on teen pregnancies. So those numbers aren't in yet. But in previous years, there's been a steady downward trend with less and less teen pregnancies over time. The Medicaid program, in a series of interventions that started, I think in 2018, started making long-acting reversible contraception. It's like an injection that women get that acts as a safe, effective birth control device. And we introduced that as a benefit. Then we increased the payment so the providers would go through the extra training and time and things that were needed to do that. And as we've seen the usage of, it's called LARC, long-acting reversible contraception, as we've seen that go up over time, we've seen the number of pregnancies actually decrease. But not contraception, chemical contraception isn't for everybody. And so the DOH still really wants to do everything we possibly can to educate, work within communities, work with teen peers and the like. And I think the recent RFPs and activity is more based on just our ongoing programs that we have and not a specific brand new initiative. And last, I do want to say this, because in your written question, you mentioned this very, very tragic incident in Hobbs where a baby was found in a trash container. There is a law in New Mexico that allows any parent with any child less than 90 days old to bring that child to a safe spot, a fire station, a police station, a hospital. And if that burden of caring for a young child has just become too overwhelming, DOH, the state, local governments stand ready to help you with that, and you can bring that baby in. And so, every life is important, every life is valuable, and we want to do everything we can to help young parents who may not have gotten the parenting classes and education that could have benefited them. So thanks for that question.
Okay, next we're going to go to Ryan Botel at the Albuquerque Journal, and then after Ryan, we'll have Chris Mckee from KRQE News.
Hi, Dr. Strace. This is Ryan at the Journal. Thanks for taking our questions. I wanted to ask you about the same chart that you brought up, the vaccination versus unvaccination report from the last 4 weeks. You pointed out how that data shows that the vaccines are still very effective, but if you look at that report, that specific report of just the last 4 weeks for the past 3 weeks when we've had it with booster and just fully vaccinated worked in, it has kind of changed in the last 3 weeks with boosted individuals and vaccinated individuals taking up a greater percentage of serious cases. What do you just kind of make of that? Do you have concerns about just how long lasting these vaccines are? And just kind of comment on that a little bit for me, if you would. Thank you.
Yeah, I think it's a really good question, and I'm really glad. I just want to bring this up to show people. I think what you're saying is if you follow these, like this is since the beginning of the pandemic, since even before there were boosters, and you can get a rough sense of these proportions here. But if you look just in the past 4 weeks, these blue and green proportions are bigger. And you know what's going on with that? And I think I'm not surprised at all. I think, what we're seeing is shifts in the coronavirus happening every 6 months that we tend to see much less frequently for the flu. And recall that the flu shot that hopefully all of us get every fall, it only lasts for about 5 months. And it's a different flu shot every year because it's tailored to what's coming through the community at that particular point in time. Technically, it's tailored to the flu cases they saw in the winter in Australia, which and Southeast Asia compared to the summer where we're at the time. And so it doesn't surprise me that a vaccine would become less and less effective as the virus evolves more and shifts from, as we saw, the initial strains to Alpha, to Delta, to Omicron. So I'm not surprised by that at all. I think the talk in the scientific community is, can we do better on the vaccines? It's not an accident that the virus mutates in a way to avoid the vaccine, right? Because if a vaccine covers biologically, 3 different angles of the virus, the next virus will go for 2 of those angles, like we saw with Omicron and et cetera. So I think it's going to be an ongoing fight. And I think the talk about a universal vaccine that deals with a part of the virus that isn't as likely to mutate is one promising route that we're watching closely. But yeah, I hope to see more evolution of the vaccines and their specificity over the next 6 months. And I think too, that I think in the long run, we're going to have to get to that as well. So the COVID booster that we get in the fall is aimed at those newly emerging variants that are more likely to spread than the older variants. So I wish it wasn't true, but I'm not really at all surprised. Thanks.
Okay, next we have Chris Mckee from KRQE News. And I believe that's everyone who's asked a first question. We'll take second questions unless there is somebody else who hasn't had a first question, we can take those. Chris, you should be able to unmute yourself.
Okay. Hello. Thank you very much. Hopefully you guys can hear me.
We can hear you.
Okay, great. I had a question to expand a little bit upon the thoughts, feelings, emotions of those in the immunocompromised community. I think it certainly we can read into Twitter and comments that people post and understand that there may be some concern out there amongst those groups. But I did want to ask you, Dr. Scrace, I mean, have you heard directly from maybe any groups or doctors who specifically work with a lot of immunocompromised patients who maybe raised concerns about the changes or the direction the state was going with the mask mandate? I guess my point is that I think there perhaps is maybe an assumption out there that everybody is upset about this, and I guess I'm wondering, how much of a consideration was that before the decision? Were there any sort of dialogue or discussion that you can shed some light on?
Chris, I'm worried this is a trick question. And if I say I haven't heard from anyone, that by the time this is over, I'll have 10,000 emails. But no, I know you didn't. I think that, one thing to realize is immunosuppressed people have been dealing with their higher risk long before the pandemic started. So I have patients who are immunosuppressed that have been coming to my office for a really long time with a mask on and the like. And so this is not new. I think I've heard from a couple of immunosuppressed people who said, what are the tools that we have available to help them, go through this transition? But I think the main thing that can help immunosuppressed people in New Mexico isn't really a public health order requiring us all to be masked forever. It's actually what would help them the most is kindness, compassion, awareness, acceptance, that some of us are going to have to continue to take all those same old precautions we did during during the worst of the pandemic and even before the pandemic. So we talked about this with the medical advisory team somewhat. I think there wasn't a huge pressure there. There was a lot of concern about having, individuals visiting in the hospitals without masks on. But I think we have new, like I said earlier, new tools with Evusheld, with an additional vaccine, and we within 95 masks, frankly, to help further protect people. And then if we could just sprinkle a little New Mexico acceptance and kindness on top of that, I think things will go well. And Julia, you asked about 30,000, and I did get information. We texted 40,000 people who fell into the immunosuppressed category.
Okay, we have about 4 minutes left. I don't think we can get to all the second questions, but I'll take them in order. First, we have Austin Fisher and then Julia Goldberg.
Can you hear me again?
Yeah.
Go ahead, Austin.
Yeah, I just wanted to try to understand, so with the mask mandate lifted, what statewide non-pharmaceutical interventions are left in New Mexico? I understand the stay-at-home order and the shelter-in-place order from 2020 are not in effect. So are there any other NPIs that are still in effect?
Well, remember that there's all of those non-pharmacologic interventions are still effective. Masks are still effective. Distancing is still effective. Staying home, for God's sakes, when you're sick, don't go to work, don't go to the grocery store, stay home. So they're all still effective. In terms of mandates, we do have a crisis standards of care designation in place, which isn't so much a mandate as it is permissive to hospitals to also declare their state and have the state provide insurance coverage for particular providers. We still have a mask mandate in place for hospitals, congregate care settings, nursing homes, detention, prisons, and correctional facilities, state ones, that is. So those are still in place. But I think all the recommendations are also still good. Be aware of your own risks, be aware of the risk in the community, dress appropriately. If there are more cases in your community or you're more vulnerable, everyone, those folks should take extra precautions. Pandemic is by no means over. Our case count is still high. And so, but I think your question is really about mandates. And in my view, and in the view of many strongly worded emails I get, people feel like the state is in a position now to transfer the responsibility for decision-making about personal interventions and protections for one's own self, family, community, to individuals, families, and communities, and away from the state. And while I'm not a particularly political person, I actually agree with that perspective.
Okay, we have 2 hands left, and we'll end after that. First will be Julia Goldberg from the Santa Fe Reporter, and then Lou DeVizio. Julia, you should be able to unmute yourself.
Yeah, thanks, Jody. Dr. Space, at the start of the month on February 9th, the health department said that people had used less than 20% of the oral treatments that were available. I'm wondering if there's been more uptick for Paxlovid and Molnupiravir. And if not, I just have read nationally this is the case, and that some medical folks are attributing it to sort of all the moving factors with Paxlovid has interactions and Molnupiravir you can't use if you're pregnant, and et cetera, et cetera. So I wondered if you had some thoughts on that.
Yeah, Julie, I did not see that graph because we've shifted our cadence a little bit. I'll see it tomorrow. We'll get it to you. We are seeing an uptake. To be honest, when we had a short supply, we did put like a criteria list in place, and that creates a barrier. We did take that away a couple of weeks ago. We are encouraging more provider use, and we've worked with the Medical Society and the Primary Care Association and other provider groups to try to get the word out more and more and more. I think step one is removing all barriers, and like I said to your earlier question, taking away those barriers, and then considering when we get to the point where we have more demand than supply, a good problem to have rather than under treating people. So I'll see that tomorrow. And also, if you wanted more background, our pharmacists are really good and can give you more information. But I think we were seeing an uptick from what I heard earlier this week. I just haven't seen the data yet. Thank you.
All right, last question is from Lou DeVizio. You should be able to unmute yourself, Lou.
Yeah, thank you. Lou DeVizio from New Mexico PBS again. Thanks again also. With the burden of determining a mask mandate for schools now shifted to local school governing bodies, my quick question is, are they equipped to have that decision put on them, whether through like medical knowledge or really authority in the eyes of parents and all of that? We've seen in other states protests and things when a school does enact a mandate without advice from a local health body backing it up. Are there any recommendations out there that that anyone's providing for these districts, I guess?
Yeah, I was talking with Eldredon Diamassa, who's on the call today, but hasn't asked a question. I talked to him over the weekend and I said, if I were a reporter, I'd be showing up at school board meetings because I think there are going to be a lot of really, really interesting discussions. And then shortly after that, all my friends who went to their own school board meetings called me to tell me how those meetings went. So I think are individual school board members fully prepared to lead a discussion between highly opposing parties about how to reconcile and come up with a common, approach. And I've had a really long executive career, and I'm not sure I'm prepared for that. So I don't know how you exactly fully prepare for people. I think it's going to involve those things I talked about listening and seeking to understand others and being curious. I do think that there's ample recommendations from the public education department about what works and from the CDC that folks can rely on. I'm told by friends that some of that information is introduced into the discussions at school board meetings, and that, what I would term misinformation, like non-scientifically accurate information is introduced as well. But I do think the New Mexico people have it within themselves to figure this out. I think it'll be messy at first. If we're in the teenage years of learning to live with COVID right now, and if you have a teenager at home, it starts out pretty messy. And then I think it was Mark Twain that said, it was amazing when I went away to school, my parents had been such idiots. And 10 years later, when I went back home, I couldn't believe how much they'd learned. And, I think we're all in that situation where this is new. We haven't had to have these exact discussions before. And I think communities will be able to work through it. I know the public education department is poised to offer help and guidance, as is DOH. But it's a good question. And I think that's why I suggested reporters go, because I think, at least if my emails are any indication, most of us, for reasons that aren't completely clear to me, have hardened into some really opposite opinions on these things. And the answer actually turns out to be somewhere in the middle. But if you're fixed at two specific opposing poles, it's harder and it takes time to get to the middle. But I think just to close this off, Jody, because I think this is our last question. I think that preference that we could all have for being curious as to other people's point of view rather than accusing them. I think seeking first to understand others' point of view rather than making sure we're understood first, having compassion and understanding that other people have needs that are legitimate, not just our own needs at play here, and that empathy versus apathy, really trying to find a solution, the best possible solution to benefit all parties. And with that, I think we're done, Jody, and I would just encourage you all to work in your own communities, families, workplaces, to find that middle way. I think it was, and I'm not going to get this quote right, but I think it was Voltaire that said, anytime there is a long dispute between two opposing parties, in almost every instance, both are wrong. And while wrong is a little harsher of a word, Maybe it's the French translation from the French, I don't know. But I think we have to remember that we're looking for a middle way of what's best for everyone in New Mexico, not just ourselves and our family or our beliefs, but more how do we coexist together in a positive way. And with that, I deputize everyone watching and listening to think about what ways you can be a positive influence in your own workplace, community, and other situations, town hall, city council, whatever it is, to come up with a safe alternative that benefits most New Mexicans. And with that, Jody, I think we'll say goodbye unless you have any final words.
No, just would like to thank our media partners for joining us, and we'll see you next week at the same time.
Thanks, everybody.